Cleaning and taking care of instruments is probably one of the most important things we can do post-operatively, just to maintain our stainless steel instruments, to prevent them from corrosion or rust or potentially breaking. It is a several step process. The first thing you want to do is soak and scrub your instruments, then place them in the ultrasonic cleanser, and then they need to be lubricated and dried and wrapped and sterilized properly. So I've got my instrument sitting in a universal pink instrument cleaner. We're going to add water to it. And just enough to saturate the instruments. You do not need to fill this. Go ahead and allow your instruments to soak. Open all your instruments up. That way the instrument cleaner or instrument detergent can get into all the grooves and the cracks. Because if they're closed or not cleaned when they're open, you're not technically sterilizing your instruments. All right, everything is open. So I'm going to let those sit for about a few minutes, and we'll go ahead and start scrubbing. Right, now that your instruments have had a chance to soak, I'm going to go ahead and scrub. So you need a couple things. I'm going to use a nylon brush to scrub my instruments. I do have a wire brush as well to get off any rust or any staining, and then I've got rust remover. Be careful when you're using rust remover to use proper eye equipment or eye covering. It can cause ulcers if you get in your eyes. And I'm going to scrub in between all the grooves of these car malts, just to make sure there's no blood stuck in my instruments. I know, there we go. Waking up from a bad dream. And once everything is scrubbed and you're not seeing any blood or any tissue on your instrument, go ahead and place it in your ultrasonic cleanser. Actually, I'm going to pull this basket out so you're not just seeing moisture, and we'll go from there. All right, after your instruments have been cleaned, it is time to go ahead and put them in the ultrasonic cleanser. All right, so I'll go ahead and take my instruments and set them in the ultrasonic cleanser. Put the cap on. I'm going to skip the degas mode, and I'm going to let the ultrasonic cleanser run for about 12 minutes. When that's done, I'm going to rinse my instruments one more time just to get any of the ultrasonic cleanser off of my instruments. I'm going to soak them in our lubricating solution for about 10 minutes, and then I'll pull them out to dry. So after your instruments have been cleaned and dried, you want to make sure that you wrap your surgery pack. So sometimes there's a tray that you can put all of your instruments in. Sometimes you're just using a pack wrap, or the kind that you go ahead and cut. And so we have a bit of both. We have the reusable pack wraps, and then we also have the kind that you cut that we use for patient drape and to drape patients, and to wrap our packs with. And so just getting all my instruments organized, making sure that I have everything that I need. So I should have 2 pair of forceps. I have my Mayo Hager needle drivers. I've got a pair of Kelly Carmel hemostats. I've got my Alice tissue forceps. I've got 2 of the mosquito hemostats, blade handle, scissors, and a spay hook. All of our general packs also double as spay packs. It just cuts down the amount of surgical packs that you need to have as far as our clinic is concerned. So I'm going to use my Alice tissue forceps to kind of hold everything in place. The first thing we're going to put on is one of the last instruments we're going to use, which are my Elson Hager needle drivers. I'll put those on here first. You can also use your spay hook as well. can use your spay hook as well, but this is what we do here. It doesn't make a difference. Make sure all of your instruments are open, especially when being sterilized, because what does metal do when it is heated? It expands, and so that can actually cause cracks in your instruments and cause your instruments to become damaged way before they've ran out of their usage. So the next thing I put on are my scissors. So my medicine balm and my utility scissors. My carbonates on here, my Kelly hemostats, and my 2 mosquitoes. Then I'm going to put on my 2 towel clamps. Sorry, 3 of my 4 towel clamps. So you can go ahead and quarter drip your patient. And then my last pair of towel clamps I'm going to put on the opposite way of everything. So if anything shifts, the idea is that it all stops there. So I'm going to lay that in the middle of my pack. I'm going to take my 2 forceps. So I have my Atson Browns, and I also have a pair of rat tooth forceps. I'm going to go here. I'm going to put my scalpel blade under my instruments, and then I'll also put my spay hook under the instruments as well. I'm going to take the 20 count gauze. I'm getting Duncan checked out and I'm in the lobby. 10. And take another 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Pause there. This can be removed. I'm going to put my patient drape here in the middle. And then my internal indicator will go right on top. And I will show you how to wrap it. All right, so we're going to go ahead and wrap this pack. Yes, sir. You would love that one. I heard you were having a hard time.
I don't know if I'll.
So each layer that you fold, you want to create this lip. The idea is you want the surgeon to be able to open this pack, or you as a technician to be able to open this pack, or scrub nurse, without touching the inside of the pack. Let it maintain sterility for as long as we can. Remember, the packs are sterile. You technically are not. Sanitary. Gloves are sterile. The gown may be sterile, but you technically are not sterile. All right. Now, once I've folded all 3 of my corners, I'm going to go ahead and fold your top. And if you've done it right, it should look almost like an envelope. You want to fold that over. And you want to tuck that all the way under that initial layer that you made. Someone once told me it's like wrapping a cloth diaper. We never use cloth diapers with our kids, so I don't know. Then you want to do the same thing with your outside pack layer. Go ahead and fold it about halfway down. Fold it over. Fold it over to make that lip. Now stick my thumb, just like wrapping a gift, to give it a crease to fold upon. You don't want a bunch of wrinkles or areas for water to collect, because that is a breach of sterility. So sterilized, steamed, and dry are all important aspects of sterilization. If it's wet, that increases the permeability and will cause issues with your sterilization process. So I've got my internal sterilization strip that once this pack is open, we will know if the inside has met the amount of heat and pressure for the allotted amount of time to be considered sterile. The sterilization strip will turn colors. It should be the full length of the strip, and most of the times it turns brown. So now that this is wrapped, I'll go ahead and take my steam indicator tape, and I'm going to fasten it with a piece of my steam indicator tape. it's striped, but once it is completely sterilized and comes out of the autoclave, you should be able to see those lines a lot darker. So it should almost look like a zebra pattern. I'm going to tab my tape to make it easier to pull off. And to reduce the amount of handling necessary to open this pack up, I'm going to fasten it around my initial tab. So essentially when I untab this tape and pull it, this should come with it. Open, and then open my sides and open the bottom without touching the inside of my pack, maintaining stability. I'm gonna go ahead and label this. And I'll put today's date. And my initials. So, you know when it was wrapped, which pack it is, and who wrapped it. And I will get this ready for the autoclave. So some of our instruments do need to be wrapped individually. So I'm going to wrap my meniscal probe in one of the press and seal packs. Now these press and seal packs do have an external indicator on here that will change color when effectively sterilized. So place that in here, and I'm going to remove the covering over my seal. And then once I've removed my protective coating, I will fold over the sticky side. And just making sure you fold it over flat with no air bubbles and no creases, because if air can get into your pack, it is not considered sterilized. Just be flat and even all the way across. Down on the bottom, I'll write what my instrument is. So this is my meniscal probe. And I'll write the day is being sterilized, which is today. And I'll go ahead and initial it. My initials as the person who wrapped it for sterilization. Now, this sterilization pack does not have an external indicator. It has one on the back, and nothing to say what the inside temperature is or if it's past sterility. So it's got this tab that you pull off. And this is my Jacobs Chuck handle, or an extender that you can put, so that way the surgeon does not have to worry about getting their gloves punctured by the IM pin or the wire. So this is the Jacobs Chuck logo for my initials and today's date, which is 11/3/24. Right, and there that goes. So both of those blue indicators should turn brown. They've been sterilized, and then I will show you how to wrap a pack. All right, so I'm going to show you how to wrap a surgery gown so that it can be sterilized. Whether it's a very durable or sturdy disposable gown or it's a cloth gown, it can be cleaned and sterilized, especially if it wasn't used. So hopefully this will work. I want to fold everything in to the center. So the first thing I did was I took the outside part of the gown and folded over on itself. Then I'm going to take the left side and fold it completely over the right side. And I'm going to take the arm or the sleeve and fold that right down the middle. And then my gown tie, I'm going to lay right over the sleeve. Then I'm going to accordion fold the gown. That way, when the surgeon opens up the gown from the pack, once they pull on it, will all fall open, and they don't have to handle the gown, because remember, once it's steamed, the gown itself is sterile. All right, I got all folded up. I'm going to put it on the middle of one of my inside drapes, and I'm going to put a steam indicator strip on top, so when they open this up, this is the first thing they see. So if for any reason it did not pass sterility, you will know before they handle the gown. I'll fold my bottom part over and create a lip, just like that. And tuck my thumb under and create my second tab. And I'm take and I'm going to take this finger and create my third tab. So again, the idea is to be able to open this up without touching the inside part or the gown in this instance. I'm going to fold this down. I have a tab that can be pulled to go ahead and open it. And because we're not always super busy, I'm going to go ahead and wrap this twice to ensure that it stays or remains sterile. So even when you first open up a surgical gown, it is in the outside plastic wrap, or plastic and paper, and then it's in its own little blue cover. So that first wrap is going to be my blue cover, and this is going to be my external protection. Tuck this in, fold it over. Across the middle. Put this up in and lay it down flat. Then I'm going to take my steam indicator tape. Make sure I go to pull tab, go across, and tab this tape too. And all right, surgery gown. This is a large gown, and today's date. (2024), and I'm going to initial it. So it's done. One thing now to do is to put it in the autoclave so it can be sterilized. So logging in controlled drugs, you gotta make sure that you fill out all your categories. So the first thing I'm going to log is my date. So today is the 13th of November, 2024. I'm going to put my patient's last name, which is Smith, the client ID information, the dog's name. So Duncan McHurd, K9, the medication was administered versus dispensed. The amount drawn, the amount used is 1.3. The amount wasted is 0. And then the balance on hand. So this bottle of hydromorphone had 5 mLs total. We removed 1.13. So the amount left on hand is 4.55 mLs. I'm going to initial here, and I have the doctor initial behind me. All right, so steam sterilizing or autoclaving my instruments is the next step in sterility. I got my individual packs and then my surgical pack in there. I'm putting them face down. The paper side up. That way when they sterilize, steam sterilize and vent, the moisture can pass through that permeable barrier. If you put them plastic side up, occasionally it will collect water and condense against the plastic and drop down on your instruments, which will breach sterility. So I do it that way. And so my autoclave is full. The first thing I need to do is go ahead and fill my autoclave with distilled water. Push my tray back, and this lip right here is my fill line. So once I get enough distilled water to that line, that means there will be enough distilled water in here for us to go ahead and run a full sterilization cycle. Sometimes it takes a minute, usually first time in the day, but as it's used repeatedly, it does fill a little bit faster. And once it has reached or filled over the fill line, it is okay to go ahead and put it on sterilization. The thing you want to do is make sure there's no water coming out. So starting to cover my fill line, I'm going to go ahead and switch it over to sterilize. I'm going to go ahead and close your autoclave, and I want to set my timer. So this pack and these individual packs are going to sterilize for about 35 minutes, and it's already set for steam sterilization, so it's going to reach the appropriate temperature. Once the temperature is up, the ring on the inside will expand, and that's going to make sure that no steam or anything escapes, which is going to build up the pressure. Once the pressure is built up to the desired amount, the timer is going to begin to go a little faster, and once we get to 35 minutes of the desired heat and temperature, it will begin the sterilization process. Usually the first run of the day takes longer than the other ones because you're running the autoclave cold. So if you need to flash sterilize something, it's always good to already have it running. So make sure first thing in the morning you go ahead and start that first cycle. All right, so we're going to let it go ahead and heat up and build pressure and start to sterilize, and then I'll show you what to do next. All right, so the autoclave is finished. It's dinged, so I'm going to go ahead and put it on vent. I'm going to let it vent for about 15 minutes, and then I'm going to go ahead and open this up to let out any excess steam and close it and let it finish drying. So give me 15 minutes, I'll be right back. All right, so it's been about 15 minutes. It's releasing, the pressure is already down. Temperature is coming down, but the pressure is already down, so it should be getting ready to ding at any minute. Now, of course, a watch pot does not boil, so I was trying to catch it before it went off, but we will see what happens here shortly. Almost. Almost. There it is. So now I can turn it off. Then I'm going to open this up now. Once the pressure is released, you should go ahead and be able to turn that up and unlock your autoclave without the door flying off the handle. Then you open this up, watch out for the rest of the steam. So let it go ahead and manually vent, and then you can close this up and allow it to dry. What you're doing is preventing moisture coming back in and keeping everything saturated. So allow it to finish drying. And then once everything is dry and cool, you can go ahead and take your instruments and your packs out and put them in their respective locations within your hospital. Thank you. I'm going to show you how to take out sutures. This is a 2-week post-op. She came in for an emergency pyometra surgery. So she's got sutures along her abdominal incision. So the first thing we're going to do is we're going to lay her into lateral recumbency. I can put her on the side, feet towards me. 3. All the way down. There we go. I'm going to adjust my light. Excuse me. Oh, yeah. I'm sorry. I got this guy. Oh, no worries. Do you want to come over here? Mm-hmm. So a couple of ways that you can tell when the sutures are ready to come out. First thing you want to make sure is that your surgery site is quiet, which means there's not a lot of redness or inflammation. There's a little bit of scabbing. Usually about 10 to 14 days is a good time to remove sutures and look for signs that the surgical site is well healed. So we'll make sure that where the incision site was sutured, looks like it has come together and the skin is adhered. That way, when you take sutures out, there's not going to be any dehiscence. Now, this is from her ponycha. She also had a mammary mass that we removed. It came back as a benign mammary tumor. So, any other tumors that pop up or any other lumps that come on the mammary glands, we're just going to keep an eye on for now. So, I'm going to go ahead and remove her sutures. Now some of this scabbing will fall off on its own. There doesn't need any intervention from us or the owners. Put on a pair of gloves. And so I've got my suture scissors and I've also got a pair of mosquito hemostats. So you want to take the part that has the little hook to go under your suture. I'm going to start with the first knot. I think these are simple continuous stitches, if I can remember. Pull too hard, I'm doing okay. Take my suture scissors and get right up under here. I know. Do the same thing here. Okay, so there's a simple interrupt. So this will take a little bit of time, but now, if the interrupted and continuous, he did his little thing. But in this situation, you want to go ahead and cut when you're going through each segment. That way you're not pulling anything, any bacteria or anything that could possibly cause irritation or infection continuously through the suture. So I'm cutting each section. And there's a little irritation there, just because some of her tissue from her abdomen does kind of hang over. So when it heals, there's a little bit of rubbing there, but the incision site looks nice and closed. All right, so I've gone ahead and I've taken out all the sutures. There's still a little bit of healing to happen just because where the sutures were. And like I said, most of this scabbing will come off, so the owner doesn't need to scrub or do any vigorous cleaning because it's just going to irritate the surgery site. We'll probably recommend that she keep her Elizabethan collar on for another few days, just because I know as his hair is coming back and these scabs are falling off, it's going to be itchy. But other than that, she's done. Thank you. So my instruments have been ran in the ultrasonic cleanser for 12 minutes. I went ahead and rinsed them and placed them in the lubricating solution. Sorry, using my endotracheal tubes and leaving it dry. So after this, go ahead and remove the cover and take my instruments out of the lubricating solution. And to try to reduce the amount of moisture that you're just spreading everywhere, go ahead and let some of the excess moisture drip off. Then I can lay the instruments out. Go ahead and close this back up, especially if you're going to use it multiple times a day. It should be changed, if not daily, weekly, depending on your surgery schedule, but you don't want to leave it for too long because then it starts to build gunk and it is no longer a good solution to have your instrument sitting in. So daily is preferred. but clinics are different. So after I've done that, I'm going to go ahead and lay my instruments out so they can dry. So I'm going to leave them open to allow them to air dry. Then once they are dry, I can show you how to wrap them. So right now I'm organizing my instruments by type. So I'm putting my towel clamps together, my medicine bombs and utility scissors together, my needle driver together, my forceps together. That way everything is somewhat organized. That intention is that if someone were to come behind you, they wouldn't have to search for the instruments that are supposed to be in each particular pack. They should already be there and be together. And that avoids instruments not being sterilized with their pack and having to be wrapped separately, potentially losing or not being able to account for all of your instruments. So our general packs usually have 2 or 3 types of scissors, depending on whether it's a large or small pack. So I've got medicine balms, sharp blunt and sharp utility scissors. I've got 2 mosquito hemostats, and I've got 2 Kellys and 1 Carmalt Olsen Hager needle drivers, 4 towel clamps, round Adsons, and rat tooth forceps, my Alice tissue forceps, and 4 towel clamps. Now what's going to go into my pack is my internal indicator strip. So we have the OK strips. Right now everything is tan or cream colored, but once steam sterilized appropriately, the whole thing should say OK and the line should be completely full. So leave these to dry for a few minutes, and then I'm going to show you how to wrap a pack. Another important task to know how to do, or know how to do efficiently, is how to go ahead and place on and take off a scalpel blade. So the only things you're going to need for this is, of course, your scalpel blade handle and a pair of hemostats. I work better with mosquitoes, and it might be a little easier when handling a blade. So during some procedures, you have to use multiple blades or just one. And if you're a scrub nurse or scrub technician, you should probably know how to put on a surgical blade. Place that back there because that's not how I meant to grab it. So grabbing your blade by the handle, on the inside of your scalpel blade handle is a notch and an angle. So the blade can only go if it's lined up with the angle. So you see the base of this blade has to line up with the angle on this. So if that doesn't work, then you probably need to turn your blade around, making sure to avoid the cutting surface. And of course, if you're putting the blade on your scalpel blade handle, you're gloved and you're considered sterile. So you want to slide this down, and it's going to lock when it's in place. So ensuring that both of these line up accordingly, so the angle should match, and you're going to go ahead and slide this down, and it's going to lock right into place like that. So now you have a fully functional scalpel blade and handle, and when it is time to take it off, you grab it by the bottom here, and you're going to pull out and push up just slightly, and that pops it out. This can now go directly into the sharps container, and you make sure whoever is cleaning up the surgical site or your surgical suite does not get pricked with the scalpel blade. So make sure you check before you begin to tear down or deconstruct or clean surgery, those words used interchangeably, that there are no scalpel blades or needles hanging around. And that's how you keep yourself safe. Thank you.